Hello, my name is Sydney Hoffman. Today, I will be talking about the social problem teen pregnancy. Specifically, I will outline the prevalence, impacts, and significance. I will then introduce the social theory, ecological systems theory. With this, you will hear about the traditional explanations of teen pregnancy versus the application of ecological systems theory and how it accounts for teen pregnancy. Last, I will discuss 5 empirical studies and how they correlate between teen pregnancy and the social theory that I have chosen. I want to set the stage with this short video called Teen Nancy. I know this video is not in English, but I feel the message is very real and very relevant.
Nancy? Nancy! Kakain na! Ano ba? So, ano balak mo? Hindi ka kakain.
Ben, buntis ako.
Ano?
Ano plano mo?
Sorry,
Paano ako? Hindi mo to pananagutan?
hindi ko alam. Sorry, hindi ko ka talaga kaya.
Ben. Ben. Ben.
Hoy! Ano ba? Sumod ka kaya? Bingin ka ba?
Ma,
Ano?
buntis ko ako, ma.
Yan ang sinasabi ko. Buntis ka. Pinag-aral kita para magkaroon ng laman yan. Hindi para mabuntis. Naiintindihan mo ako?
Eh, di ba ikaw din naman noon, ma?
Bastos ka!
Kaya ka lang nagawa yung dahil kay Ben ko naramdaman yung pagbaba na dapat ikaw ang nagparamdam.
Yan ang naiintindihan mo.
At yun yung hindi mo maintindihan!
Now that you have watched the video, take a minute to think about what you would have done if you were a teen parent. Who would you have confided in? Who would you have blamed? Or maybe you were a teen parent. How did you feel then versus how you feel now? And what do you think led up to it?
Nancy?
Now we are going to discuss the prevalence, incidence, and some statistics and data. In 2022, the teen birth rate was 13.6 births for every 1,000 females in the United States. In Pennsylvania, the number does lower to 10.6 births per 1,000 females, and Pennsylvania is ranked 15th in the United States. To put a number to it, there were 143,789 births to females between the ages of 15 to 19. And of that number, 14% was not the mother's first child. As you can tell from the graph, there has been a steady decline in the number of teen pregnancies annually. However, teen pregnancy continues to impact the infant, parents, family, and community overall. Continuing to explore the statistics of what could be leading to teen pregnancy, let's look at how some of their behavior trends. Exploring the trends of high school students' sexual behavior from 2013 to 2023, the amount of youth that have not worn a condom during intercourse has remained a constant 52% in the last several years. That's over half. And only 33% used effective hormonal birth control. These statistics alone show the likelihood that number of teen pregnancies could remain the same or even increase. Now let's take a look at race, ethnicity, socioeconomic status, and geography. The birth rates for American Indian, Alaska Native, Native Hawaiian, other Pacific Islander, Black, and Hispanic adolescents were more than double the rates for white adolescents. Southern states and rural areas also have higher teen birth rates. Impacts on health, mental health, and the youth. When it comes to their health, an adolescent is at an increased risk of complications during and after birth. These complications include preterm delivery, eclampsia, postpartum hemorrhage, anemia, and illness or death. Additionally, they are more likely to experience increased depression, anxiety, and poor social support. Additional health risks associated with sexual activity are sexually transmitted infections, or STIs, and HIV. Within education, teen pregnancy is the leading cause of high school dropout. According to Fact Forward, 51% of teen moms get their high school degree by the age of 22. This is 38% lower than the average female. Some long-term effects include the family living in poverty. As a result of possibly having to drop out, the parent would have a difficult time finding a job where they make enough money to sustain. Without the necessary financial means and increase in childcare costs, the parent may need to result in not working. This would lead to the family relying on public assistance. Fact Forward also notes that teen pregnancy affects the foster care system in two major ways. Teens in foster care are more likely to become pregnant, and babies born to teen mothers are more likely to be placed in foster care. So specifically, they are 2.5 times more likely to get pregnant if they're already in care, or if they are not in care, they're at 2.2 times more likely to have a child placed in foster care. As there are risks to the mother, there are risks to the infant. During and after pregnancy, the infant is at increased risk of low birth weight, which could lead to long-term adverse health and developmental consequences. They are also at an increased risk of illness or death. Furthermore, they are at risk for failure to thrive, instability, and other adverse childhood experiences, or ACEs. One of the long-term effects could be related to the child's education. They are 50% more likely to repeat a grade, less likely to complete high school, and have overall lower performance on standardized tests. Thinking back to relying on public assistance, something interesting that I had found in South Carolina is one of those southern states with the increased rates identified that 166 million taxpayer dollars go to teen pregnancy due to public welfare in 2010. These statistics came from an initiative advocating for more prevention efforts and services. So let's look at the etiology in a traditional sense. Traditionally, individuals believe the cause of teen pregnancy and lack of sex education, moral failings, and not abstaining. Broken homes, peer influence, and media influence. Many people believe that people just don't know how enough to do what is, quote, right on right. They also believe teens just think they make poor choices and think they're untouchable. Furthermore, if a child is living with a single parent, then they must not be adequately supervised and are doing whatever they want. At least that's what they say. Additionally, looking at a teen pregnancy from a medical perspective, an increase in hormones in teenagers during the time of puberty leads to mood swings and an increase in sexualized behaviors. This increase in sexualized behaviors then impacts the risk of teen pregnancy. Often, this is what many people blame on teen pregnancy as well. So it's raging hormones. Next, here's a video that explains ecological systems theory. This is a theory I have chosen to analyze and explain teen pregnancy.
Ecological systems theory is a way to understand how people develop. It was created by a psychologist named Urie Bronfenbrenner in 1979. This theory explains how different environments affect a person's growth and behavior, the 5 systems. Bronfenbrenner's theory includes 5 systems. Each system surrounds a person and influences them in different ways. Let's look at each system. Microsystem. The microsystem is the closest environment to a person. It includes places where people have direct interactions. Examples are family, school, friends, and neighbors. In the microsystem, a person has direct contact and relationships. These interactions have a big impact on development. Mesosystem. The mesosystem is made up of the connections between microsystems. For example, the relationship between a child's home and school is part of the mesosystem. If parents are involved in school activities, it can help the child do better in school. These connections between different parts of a person's life are important. Exosystem. The exosystem includes settings that do not directly involve the person, but still affect them. For example, a parent's workplace is part of the exosystem. If a parent has a stressful job, it can affect how they interact with their child at home. The child is not directly involved with the workplace, but it still impacts their life. Macrosystem. The macrosystem is the larger culture and society in which a person lives. It includes laws, customs, and cultural values. For example, growing up in a country that values education will shape a person's views on learning. The macrosystem has a broad influence on all the other systems. Chronosystem. The chronosystem involves changes over time. This can include big events like moving to a new city or smaller changes like growing older. These changes can affect all the other systems. For example, a family's financial situation may change, which can impact the child's development. How it all fits together. All 5 systems are connected. They work together to influence a person's development. Changes in one system can affect others. For example, a change in the macrosystem, like a new law, can change the exosystem, which might then affect the microsystem. Why is it important? Theory helps us understand that development is complex. It shows that people are influenced by many factors. These factors come from different environments, not just one. Understanding this can help parents, teachers, and others support healthy development. Real life example. Imagine a teenager named Alex. Alex lives with his family, microsystem. His parents have demanding jobs, exosystem. They value education, macrosystem, so they are very involved in his school, mesosystem. Over time, Alex goes through different life stages and experiences changes, chronosystem. Each part of Alex's life is connected. The stress his parents feel at work can affect their interactions with him. Their involvement in his school can help him succeed. The values of their culture shape their priorities. As Alex grows, the influence of these systems will continue to change and shape his development. Ecological systems theory.
All right. So as the video explained, ecological systems theory helps us understand how various environmental systems influence an individual's development and specifically focus on the psychological and individualistic equilibrium. According to Payne, ecological life models of social work seek to incorporate an awareness of social concepts such as fit and adaptiveness, life stressors like teen pregnancy, and the life course. So let's explore how ecological systems theory accounts for teen pregnancy and any strengths or limitations that come from it. Alrighty, a critical analysis of theory and its ability to account for the problem. In order to put teen pregnancy to ecological systems theory, let's compare the traditional beliefs that were discussed earlier to the evidence-based cause and the specific level it falls into. The traditional belief that the lack of sex education accounts for teen pregnancy would actually be the need for quality sex education, as abstinence-only programs are linked to actually have higher pregnancy rates, while a comprehensive sex ed reduces the risk of pregnancy. Within ecological systems theory, this would fall into the exosystem and macrosystem as it relates to the school curriculum, state education policy, and cultural norms and attitudes. The next traditional belief that youth get pregnant because of their own poor choices and feelings of being untouchable can be compared to the evidence-based cause of how socioeconomics influence pregnancy rates, such as poverty and stress. And due to the economic impact, this would be the macro system. The traditional belief that single-parent households lead to teen pregnancy correlates with the evidence-based cause of family dynamics, which would be the microsystem level. Not all single-parent households have a lack of supervision. Their family dynamics are more impactful, and the parental support and communication and monitoring are more beneficial. Some strengths and limitations. Some strengths of utilizing ecological systems theory is that it is a holistic perspective. We are able to look at the whole picture and how the family, friends, and community impact the child instead of pointing solitude or blame. Another strength is that related to looking at the whole is being able to identify different levels of influence. From the microsystem to the chronosystem, there are diverse impacts to the child. Additionally, it looks at social factors as well as the environmental factors, from poverty to access to healthcare. So ways that social work can specifically utilize ecological systems theory in addressing and preventing teen pregnancy is through sex education in schools, community workshops, and community health outreach. When a social worker is working one-on-one with a child, they could apply this theory through collaboration with a teacher or a mentor, so that would be within their mesosystem. They can work directly with the parents and the child through the microsystem, and so on. So where are they already doing this work? Social workers work with teen parents in a variety of roles, from being in schools, in the community, and in healthcare settings, providing both prevention and intervention work. Perinatal social work is becoming more prevalent and would be able to serve this population. Some examples of programs within our area, I should say the Harrisburg area, should be Healthy Start, ELECT, and Nurse Family Partnership. They can all be analyzed utilizing ecological systems theory. The microsystem is direct relationship and trust building with teens. The mesosystem would be connecting with the home, the schools, healthcare, community. The exosystem would be linking to the broader systems like housing, public health, and social services. The macro system would be involving policies, cultural norms, and institutional funding structures. The elements of psychodynamic person in environment practice within ecological systems theory heavily influence its application to teen pregnancy. So now let's talk about 5 empirical studies regarding teen pregnancy and incorporate it into what has already been discussed and utilizing ecological systems theory. The first study we will look at is the impact of social and cultural factors on teen pregnancy. This was completed in 2015 by Akella and Jordan, identifying that the U.S. has the highest level of teenage pregnancy among industrialized nations and unequivocally higher among African Americans. This study utilized Bandura's social learning theory to identify factors that influence their behaviors. As a reminder, Bandura's social learning theory is the reciprocal interaction between cognitive, behavioral, and environmental determinants of human behavior. They completed 20 in-depth interviews with teen mothers that were identified through a community outreach program. Themes that they were able to pull were that all these participants came from single-parent households with low socioeconomic status. A majority of the participants had more than one child. A sense of permittance by the teen's parents was felt. Interventions were needed to support their goals and ensure that they complete school and keep them from falling into a cyclical behavior. Overall, the analysis suggested that there is a link between poverty, education, and culture. The next study is the impact of a community health worker home visiting intervention on any inadequate prenatal care among ethno-racially ethno-racially diverse pregnant women of the U.S. Southwest. This study was aiming to identify social and structural barriers that drive disparities in prenatal care utilization. Utilizing score matching, it was identified that teens were at a significantly increased risk of not receiving prenatal care, leading to the need for perinatal home visiting intervention to serve this way they can serve socioeconomically disadvantaged females. The ecological systems theory could be utilized in these interventions. When looking at things that lead to teen pregnancy, access to contraception is high on that list. Policy impacts on contraceptive access in the United States, a scoping review, identified that policy decisions influence the access to contraceptives and changes the available options. By reviewing U.S. federal policies on access and then outlining in a framework, they had gaps and needs that were identified to help direct future decisions. The studies specifically examined access, affordability, and appropriateness, as well as the impact of abstinence-only sex ed and the Teen Pregnancy Prevention Program. And looking at this study in comparison to what we have already discussed, this would result in the macro level work. As we discussed above, there are many impacts on children of teen parents. The study, Consequences of Teenage Childbearing on Child Outcomes in the United States, goes into further depth of these impacts deriving between the difference of having a young mother or selection into teen motherhood. This was done to most effectively identify policies to improve child trajectories. The outcome? A negative relationship between teen childbearing and child outcomes. This is exactly what we had discussed earlier when we discussed about the negative impacts on a child. A specific aim is to improve the background conditions and opportunities for teen parents. Now, let's switch and let's look towards the future. For the last study that we are discussing today, we are looking at the repetition of teen pregnancy. How accurately can we predict repeat teen pregnancy based on social ecological factors? By Harding et al. They looked at how factors at the various levels are impacting possible cyclical behavior, such as having another baby while still being a teen. 945 pregnant and parenting teens were included in the study, and 86% were Hispanic or Latina, which would closely depict the inequity that is represented within the United States totals. So as I said earlier, Hispanic families were at a much higher rate than white families. Significant predictor of repeat pregnancy were the teen mother having a parent with a serious drinking or drug problem when she was a child, being older and not living with a mother figure, not intending to abstain from sex or use a long-acting reversible contraceptive, and having lower resiliency skills. These risk factors can be utilized for providers with working with pregnant and parenting teens to reduce the likelihood of repeat pregnancy. Each of these factors can be utilized in the micro aspect, meso, and macro. Now, let's take a step back and look at everything we have covered regarding teen pregnancy, the prevalence, implications, and risk factors, and how ecological systems theory can be utilized to explore the dimensions and causes through a theoretical lens. While the number of teen pregnancies are decreasing, it is still a major social problem that needs to be addressed. The ecological systems theory can examine the interconnected systems for the adolescent and how they contribute to one another. This is a different approach than the traditional beliefs of the etiology of teen pregnancy and can help increase prevention efforts in related areas. A social worker is able to work with the family in various aspects to take on prevention or intervention methods. Within the ecological systems theory, change happens through interaction among the various levels, micro, meso, exo, and macro system. And this is shown through the theoretical approach to teen pregnancy. These are my list of references then. All right, and thank you.